Yeah, so the project that we're going to be presenting at the MAAUA is going to be actually talking about um, the waste that we produce in operative urological like surgeries, essentially. And we just wanted to get a clear idea of what exactly um, our our like operative waste is, just because we currently have no metric, no standard for just knowing how much is being produced in these situations. We have rough estimates of like what hospitals are producing, but this is like including all of like the medical side of care. But we just wanted to essentially just characterize what the burden is for these operative waste. Um, and just a little background on what exactly why this is important is because the healthcare sector, I'm sure most people know, is a really big contributor to greenhouse gas emissions, not only in the U.S. but also just worldwide. I think U.S. hospitals, I think it's been estimated that they produce like about like 4 billion pounds of waste every year, and it was just like Dr. Cohen was just like it's kind of crazy how like we produce so much waste and like all these like surgical equipments and all these like linens and like everything that we use in the operating room when caring for our patients, that there is like no measure of this. Like it's just all going into like the landfills. Um and he just wanted to be he wanted to create like a little more clarity on what exactly we're producing and like how we can mitigate this as much as possible to like address the climate crisis. Just because it is such a big burden. Also, it costs a lot of money for everyone just to clean up all this waste and like properly dispose of it. So that's exactly what we did. We measured urological waste because Dr. Cohen's a urologist, and we observed 31 cases in a certain time period, and we pretty much just measured everything from the beginning of the surgery to the end of surgery, and we just wanted to see like, all right, how much waste are we producing? How much does it weigh? How much volume does it take up? And what exactly are we throwing away? So we categorized the waste into like three different categories, and these were laundered linens, normal solid waste, which is going to be like your plastics produced from like opening up all like the new surgical equipment or whatever, and also regulated medical waste. So this is going to be like your biohazardous materials. And what we were able to see is actually on average, we were producing about 11 kilograms of waste per case. And this amounted to about like 1 meter cubed of volume generated per case. And when you actually look at the breakdown of what exactly is going on in those three categories, the normal solid waste, so like again, like the plastics, the screws, etc., take up the majority of them. So it's like about 50% in this in our study that we found. So there's a lot of waste being produced, and a lot of it is from just like packaging, just generally things that we just throw out. And it was also important to note that there are protocols placed in ORs to try to help like organize the waste, so just so the disposal process is as efficient and waste cost effective as possible. But all 31 cases that we looked at actually deviated from the normal recommended disposal practices. And it's not like a fault on any of like the OR teams. It's just not super standardized. These are just recommended. And also, it was interesting to note that there was no recycling protocol in the OR. So everything that was being like essentially thrown away is going into like the trash, the landfills. So this was also a place of importance to like maybe we can do something about this to mitigate it. So I think just overall, we were just able to see that there are further steps that we need to take in order to manage surgical waste. And this is not just in urological waste, it's also in any type of like uh, medical specialty that involves an operating room, just because operating rooms do produce a lot of waste. So this could be like different specialties like ENT, plastics, and just having this idea that, okay, we should be cognizant of the waste that we're producing. Although we are trying to maximize the care for the patient, we should also be taking steps so that we can like have like a healthier planet. And yeah, so that like the next steps that we were like thinking about were like just like proper segregation of the medical waste, the role of recycling and reusing, better packaging for surgical equipment, which is something that Dr. Cohen is like a big proponent of, just because he sees all the waste, and every time he opens a new tool, a new piece of equipment, it's just like a lot. And just general research expansion across other ORs. So that's like a quick summary of what we will be talking about the MA AUA.
And we could be in whatever.
Okay, cool. So at the MA AUA, I'm going to be talking about how we characterize the burden of intraoperative urological surgical waste. And we just wanted to highlight some opportunities for reduction and mitigation. So what exactly we did was we observed 31 total cases during a certain time period. And we measured what exactly was being thrown away. And this started from the beginning of the operating room prep to the disposal of PPE, personal protective equipment. And we assessed what exactly was being thrown away in 3 different streams. So we looked at laundered linens, normal solid waste, which is going to be like your plastics and your like screws and like your equipment that you're being thrown away. And we have the regulated medical waste as the third one, which is like your biohazardous materials that cannot be normally properly disposed of. And what we were able to see from this was actually that there was about 11 kilograms of waste being produced per case, and about 1 meter cubed of volume of waste generated per case. And when you actually look at the breakdown of this, we were able to see that normal solid waste actually accounted for more than half of the total solid waste. So this is like all the plastics and like materials that were being generated that took up a lot of the volume and also the weight of what we were producing. It was also important to note that about 31 of the cases deviated from normal recommended disposal practices, and there's also no recycling protocol in the OR. So the next steps for that we would like to be shown to other urologists or just people in general is that surgical waste is a big factor that contributes to the overall healthcare waste. And we want to ensure that there's proper segregation of normal solid waste and regulated medical waste, just because it does place a burden on the disposal process by having improper segregation. We also want to highlight a potential role of recycling and reusing of all the materials and plastics that are thrown away, and just overall just having generally better packaging of surgical equipment. Dr. Cohen is a big proponent of this, just because he sees it day to day during his urological surgical cases, how much plastic waste is actually being produced from all the packaging. And this is like a big thing for him, where he's just not very happy about it. And also, we just want to just expand research of this very important cause to other ORs, not only in urological cases, but other medical specialties, just to highlight the burden of waste.